Hello everyone. Now I would like to talk about end of life care or palliative care, which aims to help if you have a life limiting or a life threatening illness. Let's begin with the first module, palliative care. The learning objective being improving quality of life of those facing life threatening illness. The scope, who requires the care and the treatment the most. Cancer diagnosis, common questions like who, what, where, what are the symptoms of the ones diagnosed with cancer. The support system, continuous exercise and physiotherapy helping you reduce stress, palliative care for children to reduce distress, hospital care, which becomes very important in this scenario. It is basically a multidisciplinary approach. Now, let's begin with the next module, role of hospice care. What is hospital care at the end of life? An overview. How does it help us? Myths and realities of hospital care, not only for the people who are dying, but for all. Interdisciplinary and multidisciplinary caregivers' role. Levels of services to a patient as well as caregivers. End of life support. What is the eligibility to gain hospital care? Finally, how does it benefit and make a difference? Now comes the next submodule, caregiver's role. What is the learning objective? What is caregiving? The types of caregivers, formal and informal both. Why do individuals choose this field? Approximately 15% feel fatigued after caregiving. Why so? Effective caregiving relationship between the caregiver and the patients. Mode of sustenance. Psychological well-being of the caregivers. Factors affecting the role as a caregiver. Optimal caregiving. And finally, what have you learnt from this submodule? Now, let's move on to the final submodule of this module, end of life care. It is way towards a dignified end of life. Beginning with, what is end of life care? Present situation analysis. Changes before death. Professional responsibilities before and after death. What's important before and after death? We always need to take care of that. The COVID-19 death that is happening nowadays, how to deal with it. End of life care for children. Smooth issuance of death certificate. Maintenance of hospital cleanliness. Cleanliness and hygiene becomes very important now. Role and precautions to be taken by family members, especially now when we are dealing with this crisis situation. Conducting rituals safely. Finally, the precautions that we must take and follow when we manage end of life. Let's end with the references of all these submodules. Thank you and keep watching for the further details.